COVID-19 new challenges in the COVID-19 infection spread in the world very fast from January the 20th to March the 20th, whereby in March all the world was infected. Spread of COVID-19 in Iraq started very gradually until it reached June, whereby it has accelerated dramatically to reach 56,000 infected. It is important that we consider the complications of COVID-19 infection in relation to dentistry. The dental hygienist is at risk to get the infection at about nearly 100%, and the dentists with all the specialties ranges in the 92 to 93% possibility. In the dental office, we have to change the furniture and the understanding of how the patients will sit in the dental office. First of all, the chairs that patients sit on, the chairs in the reception and treatment room, they have to decrease dramatically, and the units have to be isolated from each other so that the aerosol that is generated in the dental unit here has to have an air ventilator near it to extrude all the aerosol. In large dental offices or colleges, the waiting room should harbor very few number of patients. The escorters or other patients, they have to wait outside in the air until their time comes. They introduce them to the waiting room. Second, all the dental units have to be isolated from the other. And third, the dental staff have to be isolated in the place where they sit or eat from the patients, and there should be areas that are forbidden for the patients to wander around. There are certain risks in the dental departments. First of all, we have treatment that takes a long time, so aerosol may stay in the dental office for a long time. Conventional protective measures are never 100% effective, and treating patients already carrying the virus could easily lead to the spread of the disease. Now, when an infected patient comes in the dental office and he coughs, he will generate droplets, and this is airborne to infect individuals. If this patient sits on the dental unit, he will contaminate the dental unit, and the turbine will make droplets and aerosols that will contaminate even more, and the direct contact and the indirect contact may affect the dental professionals in the dental office. We have to categorize the dental procedures into non-urgent, urgent, and emergency procedures. The non-urgent and urgent procedures, they have to start with what we call teledentistry, whereby diagnosis is done by mobiles, and we ask the patient to open up a video and we see what is his complaint. If he has symptoms, we treat the patient as if he has got an emergency procedure, whereby we schedule an appointment and we screen the patient, we measure the body temperature and do the treatment, but the follow-up has to be done by teledentistry. We should not let the patient come back for follow-up because he will be at risk of infection, or he may, if he's infected, he may give us the risk of infection. Dental treatments in conservative dentistry, the most important is severe dental pain. Here, the patient cannot and should not tolerate severe dental pain more than necessary. So we have to deal with this. Abscess or localized bacterial infection with pain and swelling, they have to be dealt with by incision and drainage of the pus. Tooth fracture has to be dealt with because it may have pain or soft tissue trauma. Dental treatment required prior to critical medical procedures, as in medically compromised patients. Aesthetic condition, whereby sometimes a fallen crown or a fallen temporary crown has to be replaced immediately. There are other urgent dental cares, for example, dental caries causing pain, and in this case we've got extensive dental caries, or managing of teeth being endodontically treated when urgently needed.